I'm going to talk to you about high cholesterol, the causes, the consequences, the symptoms, and the treatment. I'm going to break this discussion down like so. Number one, I will talk to you about the definition of cholesterol. Number two, we'll discuss the consequences of having high cholesterol or hyperlipidemia. Number three, we'll talk about what the blood work means. When you go to your doctor and you get that lipid panel, that cholesterol panel, I'll talk to you about what those numbers and all those letters actually mean for you. Number four, we'll talk about the risk factors of high cholesterol and the causes. Number five, the symptoms of high cholesterol. Are there symptoms? Finally, number six, we'll talk about the treatment. So let's go. High cholesterol. Okay, so first off, what in the world is cholesterol? Well, cholesterol is a waxy, fatty substance that is produced by the liver and many other cells in the body. You see, all of the cholesterol you actually need is produced by and made in your body. And cholesterol is not all bad because we actually need cholesterol in our bodies. We need cholesterol to make cell membranes, and we also need cholesterol to make certain hormones, including testosterone and estrogen. We also need cholesterol to produce vitamin D. So you see, we definitely do need cholesterol. The problem is when we have an excessive amount of cholesterol, we get hyperlipidemia, because when that happens, you start to have a problem. This cholesterol will float around in the blood and pick up other inflammatory cells, and it can actually become a plaque or an atheroma in your blood vessels or your arteries. So then you have these arteries that are blocked by the cholesterol, this fatty waxy material, and certain inflammatory cells and certain calcium deposits. And if that happens, you can get a narrowing in these arteries or in these other blood vessels. Once you get this narrowing, that means you're not getting a sufficient blood supply. You're not getting the proper oxygen supply to tissues. And this cholesterol plaque or this atheroma can actually completely occlude or obstruct the blood vessel. It can block the blood vessel. So what happens if you get a blocked blood vessel or artery that is supposed to be sending a blood supply to your heart? Well, you can have a heart attack. If you get a blocked artery that's supposed to be supplying your brain, you can have a stroke. And if you get blocked arteries that give blood supply to your arms, to your legs, to your fingers, to your toes, then you can get very poor circulation. You can have peripheral artery disease. So these are the consequences of having high cholesterol. So now let's talk about the types of cholesterol and what they mean for you. When you go to the doctor and you have him or her to check your cholesterol, they order a lipid panel or a cholesterol panel, and you'll have many different names, numbers, and letters. So let's break down what these things mean. On this lipid panel, you will have a total cholesterol, and this is a sum that includes both your good cholesterol, or the HDL, and the bad cholesterol, the LDL. Now, the rule of thumb is that the total cholesterol should be less than 200 milligrams per deciliter, but you must consult your physician to find out what your total cholesterol means for you, because if you have an exceedingly high good cholesterol, then you may also have a high total cholesterol, but that could be driven by your good numbers. In other words, it is possible for you to have a total cholesterol that seems high, but it's not as bad as one may think because you have a great good cholesterol. Bottom line, the total cholesterol is not so discriminate because it has good cholesterol and bad cholesterol. Now, the bad cholesterol is the LDL, or the low density lipoprotein. And just focus on that number L. You want the LDL to be low because it's bad. And having a high LDL is something that will actually increase your risk for cardiovascular disease. Your target LDL really will be individualized because it depends on your other risk factors for cardiovascular disease. So again, you'll need to consult your physician, talk about your risk factors, and then find out your target of an LDL. On that lab work, you will also likely have an HDL, or the good cholesterol, high density lipoprotein. Focus on the letter H. You want the HDL to be high because it's good. As a general rule, we say that an HDL of greater than 60 milligrams per deciliter is excellent. But if you have an HDL that is less than 40, that is suboptimal. But again, make sure you consult your physician and find out the target HDL for you. Another type of cholesterol you may see on your lipid profile on your cholesterol blood work is the non-HDL. And you get this number by taking the total cholesterol and subtracting out the good cholesterol. You subtract out the HDL. The non-HDL includes numbers like the LDL, but also other types of cholesterol, such as the very low density lipoprotein, or VLDL, the intermediate density lipoprotein, or IDL. It includes lipoprotein A. And so you have more cholesterol than just the LDL and the HDL we discussed, and the non-HDL will include those numbers. Finally, you have triglycerides. And triglycerides, when they are excessive, are also bad news as far as being a risk factor for cardiovascular disease. Rule of thumb, triglycerides should be less than 150 milligrams per deciliter. Again, you must consult your physician. I cannot stress this enough to find out your specific goals for cholesterol. Now, let's talk about the risk factors for high cholesterol. Who is at risk and what even causes one to have high cholesterol? Remember, I stated at the beginning of this video that in some cases, even if you exercise, even if you have a healthy diet, you may still be predisposed to high cholesterol. So let's talk about that here. So first off, the risk factors. Cigarette smoking is a risk factor for high cholesterol. So if you are running around here smoking cigarettes, then yes, you are at increased risk for having hyperlipidemia. Also, certain chronic diseases. If you have diabetes mellitus, that is a risk factor for high cholesterol. High blood pressure or hypertension is a risk factor. The kidneys. If you have chronic kidney disease, that's a risk factor. Obesity, another risk factor. Another risk factor for high cholesterol is if you have a strong family history. In fact, there is a genetic disease called FH, familial hypercholesterolemia. FH is a genetic disease that causes a mutation in one or more of the genes that code for the LDL catabolism. And so if you have FH, familial hypercholesterolemia, then you will have extremely elevated levels of LDL. What does that do? That puts you at a very high risk for atherosclerotic disease, cardiovascular disease, even at a young age. Some people with FH, especially if it's the homozygous type, will actually get this atherosclerotic disease as children. So having a family history and that genetic component, especially if it is familial hypercholesterolemia, will put you at risk. So when I was saying that in some patients, even if they diet, even if they exercise, they'll still have high cholesterol, I'm talking about the patients with FH. This is why it is extremely important that, number one, you know your family history. If you have a lot of young relatives who have died of heart disease or have had heart attacks or strokes at very young ages, you definitely want to go get checked to make sure that you don't have familial hypercholesterolemia. And in these patients, even if they do everything right, if they do the diet and if they do the exercise, they typically will have to take medications. Another risk factor for high cholesterol can be diet, a diet that's very high in animal fats, in saturated fats, and trans fats. So diet can certainly be a risk factor for high cholesterol as well. So what are the symptoms of high cholesterol? How will you know if you have it? Well, honestly, there really are no overt symptoms of high cholesterol in and of itself. And by the time you get a symptom of high cholesterol, it may actually be the narrowing of an artery leading to a heart attack or a stroke, at which point it's too late. So the key is prevention and screening. You want to consult your physician and you want to get screened from high cholesterol early on before you ever even have a symptom. There is something called arcus senilis, which is when you get a collection of cholesterol on the cornea or on the eye. And then there's another sign called xanthoma, which is a cholesterol or some cholesterol deposits that are located on tendons or under the skin. But again, you don't want to wait till things get to that point. You want to be screened for your cholesterol level early on before you even have a chance to get any signs or symptoms. Finally, what is the treatment for high cholesterol? What is the treatment? Now, there are some things that you can do in your lifestyle. You can stop smoking for one, and that will take away a huge risk factor for high cholesterol. And then you want to try to avoid the certain diseases, the chronic diseases that can cause high cholesterol or can predispose you to high cholesterol. Or certainly, if you have these diseases, you want to manage them well with your physician, including the diabetes, the kidney disease, the hypertension. You want to manage these things very well in order to try to prevent having high cholesterol. And then there's diet. You want to have a diet that is low in saturated fats, low in trans fats. You don't want to have a whole lot of animal fats in your diets. And there are some thoughts that certain foods can help to lower cholesterol, such as apples, lentils, chia seeds, oats. Again, before making any diet changes or diet plans, you want to consult your physician and a nutritionist. If you do all of the diets, it is possible, especially if you have a genetic predisposition, and then certainly if you have familial hypercholesterolemia, even if you do everything right, it's possible that you may still have high cholesterol. In that case, you may need medications. Some of the medications that are used in treating hypercholesterolemia or high cholesterol include statins, such as atorvastatin, also bile acid sequestrants. Zetia is another treatment, a medication to treat high cholesterol, and nicotinic acid or niacin can also be used. The key is to understand that high cholesterol is a risk factor for cardiovascular disease. It can cause heart attacks, it can cause strokes, it can cause poor circulation. So what you want to do is be aware of it, because knowledge is power. You want to consult your physician and make sure that you are screened to see if you have high cholesterol. And if you do, you want to treat it. If you enjoyed this video, if you found it to be helpful, please be sure to like it and to share it with the people you care about.